breast cancer among South African women is increasing. According to CANSA, breast cancer remains the most common cancer affecting women of all races in the country. Sadly, breast cancer has caused 670,000 deaths globally in the year 2022. Now, according to the World Health Organization. Now, for more national manager of the health programs at the Cancer Association of South Africa, Lorraine Govender, joins us now on Teams. Thank you so much for your time on the program today. So, I'm sort of middle-aged and I feel like I look great and no one in my family has breast cancer. Do I still need to do breast examinations? And who is prone to getting breast cancer? Is it men, women? Talk to us about that.
Yeah, good morning, and thank you so much for this opportunity. So everyone is at a risk of getting breast cancer. Men also get breast cancer. 1% of men do get breast cancer. So the figures stand at 1 in 922 men will be diagnosed with breast cancer. According to the National Cancer Registry, which records the cancer incidence in our country, 1 in 26 women are affected by breast cancer. So that alone shows that the risk increases among women as opposed to men. And yes, you're young, and breast cancer also affects many women under the age of 40.
And let's talk about some of the factors that increase the risk of breast cancer. Is there any risk factor that stands out, particularly in the South African context?
Yeah, I think there are many factors, and looking at the South African context, definitely if we look at overweight and having low levels of physical activity, that really does stand out, and that's one of the risk factors for breast cancer. And then alcohol and tobacco use also increases the risk. But then all women are at risk. But if you have a family history of breast cancer, it increases your risk as well. Another risk factor is women who've never had children or only had them after the age of 30 also puts them at risk of getting breast cancer. And then the fact that breast cancer is the most common cancer affecting the women in our country, that alone tells you that there will be a family history to breast cancer. And Ayanda, it's not only if you have a family history of breast cancer that you will get breast cancer. Even if you have a family history of other cancers, including prostate cancer, puts you at a risk for breast cancer and many of the other cancers as well.
And Ms. Govender, I want to actually go back to this month that we're observing, quite a very important month that we are observing, but also I have a problem, and that problem is that sometimes we tend to have these conversations around this month. These are conversations that are sort of played and paused again this month, where we bring awareness, and sometimes we even see those mobiles coming through to the townships as well as the rural areas to talk about breast cancer. Let's talk about awareness. Where are we insofar as awareness is concerned, and what will it take for these conversations to just move beyond this month?
Definitely. And Ayanda, when it comes to October, everyone says it's the cancer month, but people forget it's actually breast cancer awareness month. So breast cancer is the most common cancer affecting women, but then there's also prostate cancer among men, and there's over 300 different types of cancers that affect our people. But I think the awareness in October is definitely around breast cancer. And people see all the pink and they get caught up in the hype of the pink. And sometimes people do forget, what is this hype all about? So yes, there's a lot. We depend on print and radio media, and we're so thankful to SABC for actually having us. And there's a lot of messaging on radio as well, creating awareness. So you definitely depend on those channels to communicate the messaging around the awareness. But people still, there is the problem that, okay, I think I have a lump, but I'm not sure. So it's fear of the unknown. Should I go to the doctor? Should I go to the clinic? And then the thought of, okay, I need to take time off from work. These are some of the things that, people don't usually access the services when they do pick up the lump. And sometimes you find that women really don't even do self-breast examinations, and yet it's something that it's so easy to be done. And most of the time, you will find people who have been diagnosed with breast cancer will tell you, I did a breast examination, or I felt the lump. Sometimes, Ayanda, they don't even go for further investigations. They have the lump and they continue, they worry, they know that something is wrong. Breast cancer can spread, and once it's spread, it becomes more difficult to treat the cancer, and you lose a breast. It sometimes can even spread to other organs in your body, and it becomes quite difficult and costly to treat the cancer. And people even die. The figures that you quoted earlier on, it's quite high globally. People that die, women that die from breast cancer. And this shouldn't be, because we do have a good public health system where people can access the screening through the clinics. There's treatment available. I know of many people who have gone to the public sector and have survived breast cancer due to the treatment that they have received. So it's better that we actually access the services that we have available in our country. Yes, there may be waiting periods, but there's also hope that you will survive it.
And let's talk about the support. What sort of support do breast cancer survivors need after diagnosis?
Yeah, and this is so crucial because you often find that, between the different race groups and cultures, it changes. And often when a woman is diagnosed with breast cancer, it is a life-changing moment for them, because our breasts are they add to our image and the look and how we feel. It's also an organ that is used to breastfeed our children. So it's so important to a lot of women. But you find that there isn't much support. To start off with, people don't often talk about the breast cancer incidents. They keep it to themselves, and yet we know that if you have a genetic predisposition, it increases your risk for breast cancer. So we want more people to talk about the cancer. And if you talk about your cancer, there's definitely support available. Yes, the public sector is quite, full in terms of the support services that they have, and it may not be easy for you to speak to your doctor or to your clinician. But there are NGOs and non-government organizations that are really there to support people. So, you don't even have to go into a place. You can just call telephonically. The Cancer Association has a telecounseling line that is free to the public. It's available in over 7 different languages. There are various support groups available for people, and there are also NGOs that do use their mobile clinics, and they go out into communities and they do clinical breast examinations for women in a lot of the communities. And this is all made possible from grants that become available and donors that really want to see a difference in people's lives by giving us funding to help people in underserved communities.
And Ms. Govender, now that you've touched on funding, the rising costs of treatment poses a challenge to survivors and health funders, and that is the reality on the ground. In one incident, the Gauteng Department of Health's failure to utilize the allocated 784 million rand set aside by the Gauteng Treasury back in 2023 to address the radiation backlog and other surgical backlogs in Gauteng. That would be an example. What's the solution to some of the funding challenges that we seeing in the sector right now?
Yes, we definitely need all-of-government approach, and we really need to look at what can we do to improve the services and ensure that the funding that is being given to people is actually utilized for the correct purposes. If you look at mammogram, which is one of the diagnostic services that is available, you find that people are often disillusioned. They lose hope because they have to wait for a period of time before they can even go in for a mammogram. So definitely, if funding is made available, there can be more of the services available to people, quicker turnaround time in terms of the treatment, and definitely this can improve the quality of life. But I really want to urge the public, don't despair, don't lose hope, don't think that the health system is going to fail you. Yes, we've had many failures and challenges, but there's also hope. It's important for you to make that call to go and access that service. And the Cancer Association, and there are other organizations as well that do a lot in terms of advocacy. So, if you have problems and you have challenges and you can't access treatment or access diagnostic services, please do call the Cancer Association. We have an advocacy department that's dedicated to support and help people to ensure that we have better turnaround times for accessing treatment and diagnostic services.
And Ms. Govender, before I let you go now, there's a dear viewer at home that's feeling a lump in that part of the breast or whatever, or wherever the case may be. Let's just hear from you. Where do they go from here moving forward?
Yeah, so it depends. So if you are someone that's living in a community and you have picked up that you have a lump, you definitely can go to your nearest primary healthcare clinic, because there are many primary healthcare clinics where the nurses and the healthcare professionals have been trained on doing clinical breast examinations on you. So even if you go in for a pap smear, the Department of Health also ensures that they do a clinical breast examination. So once you've done the examination and the nurse or the healthcare provider has picked up that you have a lump, they will then refer you to the closest hospital for a mammogram. So a mammogram is done to detect, the lump and the size of the lump. After that, you will then go in for a biopsy to just check whether the lump is malignant or it's benign. So not every lump, and this is important as well, not every lump means you have cancer. So, sometimes those lumps are benign and you may not even need to go for further investigations or to have a mastectomy or your breast removed. So those are some of it. And if you are still not comfortable with that, please do go to the Cancer Association. We do screening for people, clinical breast examinations. Our number is 0800 22 6622, or you can even go to your healthcare provider. If you are still worried, you can also access your hospital to say you want to go in for a mammogram, and further tests can be done for you.
And Ms. Govender, as well, I think quite a cause for concern is looking at our rural areas. In your rural Ikopo, as well as Ukumbu, and other rural areas as well, people still grapple with accessibility to such facilities. Where do such people go? Does this mean that they left in the lurch?
Definitely not. And we know that government also has mobile clinics. So the mobile clinics definitely go into underserved communities. The Cancer Association also has mobile clinics, and we do go into communities. So people are more than welcome to call us if they are worried and they have a lump and they want to know where to go to. You can contact us, and we have a toll-free line that will give you information on where you can go to for further investigations. And yes, we want to access people, we want to really help people, and you must not be afraid to really go to your primary healthcare clinic that is closest to you to have that lump checked out.
Okay, that is Lorraine Govender, who is the National Manager of Health Programs at the Cancer Association of South Africa on Teams. Thanks very much indeed for your time.